All right, this opioid crisis, opioid abuse has become a huge problem across the country and here in Arizona, and the fight against the epidemic continues.
As lawmakers pass a new bill to crack down on opioid abuse, Governor Doug Ducey joining us this morning. Good morning,
Good
Governor.
to see you, Governor.
Morning,
Thank you much. Congratulations. I know this is a big effort that you put into this. Unanimous, right? House and Senate vote on this?
Unanimous in the House and Senate, Republican and Democrat, to address this opioid epidemic. This is the Arizona Opioid Epidemic Act. The scope of this problem has been huge. We lost 855 Arizonans over the last 18 months to
this.
That's
3 a day. Just put that in perspective.
Incredible.
It's crazy.
5,000 plus overdoses, 455 babies born addicted to opioids. So it was time to act. We had done some things earlier in the administration, but we called a special session on Monday. I'm very proud of our legislators, our legislative leadership, Republican and Democrat. I'm going to go to the Capitol after this interview, sign this bill at 11 o'clock. It's going to expand treatment for uninsured and underinsured. It's going to provide naloxone to reverse these overdoses that are happening.
So if you have an OD, that's something you can just inject in yourself?
It's something first responders, medics, EMTs are carrying. When they encounter an overdose, it can reverse that overdose. Of course, we want to prevent it. I mean, if we can keep people from getting addicted to these drugs.
Tell us that portion of the bill and what that will do. It will limit how long you're given those drugs initially if you have a surgery or something like that.
Yes. The first thing I want to say is for people that are in chronic pain right now and benefiting from these miracle drugs, there's no change for them. No change at all.
Okay, because I've heard a lot from that. People saying, oh, they're trying to take my drugs away.
And I've heard that as well.
Okay.
I'm out in the marketplace and people are concerned or scared, or they're a burn victim or a cancer survivor. There's no change for them. This is people that are not yet addicted. We want to keep them from becoming addicted. So if somebody has dental work, they don't need 30 days of opioids. They might not need any, but let's limit the amount that they get, because we see after 5 days that addiction skyrockets. So it's a limiting of first fills. It's cracking down on doc shopping. It's making sure that prescriptions are properly monitored. It's education for the doctor so they know when to prescribe this versus some other drug.
You mentioned, too, about allocating a lot of money, $10 million, for people that are underinsured that can't seek services to help them, because there are people out there that are addicted and they have no way to get better and they want to get better.
And we want to provide treatment so that they can get better. We're working with the Department of Health Services and Dr. Kara Christ. We have about $250 million already in treatment. We want to make sure that that's being properly applied, and we're adding $10 million to this.
You know what's refreshing to me is, we watch so much things going on in government and stuff, but you call a special session, you tackle one issue, it gets done in what, 2 or 3 days? I mean, are there other things that we can tackle going forward like this?
Well, I think that Arizona really is a shining example today to have bipartisan support, Republican and Democrat leadership, in a unanimous issue on something that is not only an Arizona issue. This is happening across the country. You and I were talking earlier about this being profiled on 60 Minutes in places like Ohio and West Virginia and all 50 states, all 15 of our. So I do think we've demonstrated leadership here and urgency on a real issue affecting Arizonans. There's a lot more to do, because this isn't just about opioids. This is also about addiction.
And it's a huge problem that just is sweeping our state. And if you don't have a personal connection to that, there are plenty of stories out there that will just break your heart.
I think every family, every extended family, every neighborhood, every school has some stories about this, and people are seeing this. So we're going to deal with it. I think we're going to definitely improve the situation. We've done this before as a state. We've had a crack cocaine epidemic, a methamphetamine epidemic, and we've been able to stamp those out largely. This is a little bit different because it starts oftentimes in the doctor's office or behind a pharmacy window.
It's not some clandestine, lab somewhere like meth was.
But people are now understanding it. Doctors are becoming better informed. Medical and addiction experts are weighing in, and we really built a broad coalition. And you can only get a unanimous vote if you do have that kind of coalition.
Congratulations, Governor.
Thank you very much.
Thank you for
Appreciate
coming
it,
in.
Troy.
All right,
Thank you.
Go sign that into law here. I don't want to delay you any further. We'll be right back. Stay with us.